Well, new this morning, uterine fibroids are non-cancerous or benign tumors that can develop within the uterus. For some women in this situation, the only option given is a hysterectomy. But did you know there is a non-invasive procedure that may help you avoid that? Here's a story. About 200,000 women have their uterus removed every year due to severe symptoms, and 1 in 4 women of reproductive age suffer from fibroids.
My gynecologist had told me that eventually I would need to have a hysterectomy, but given my circumstances with work and personal life, it just wasn't feasible at the time.
Caroline was diagnosed with fibroids and tells us she wanted to avoid getting a big procedure, so she looked into uterine fibroid embolization.
And so I wanted to look into it a little bit more, and that's when I called Dr. Lee, scheduled a consultation to see if I was a candidate, and here we are today.
Uterine fibroid embolization is a pretty popular procedure in bigger cities like Houston and Dallas. Dr. Llewellyn Lee is the only vascular and interventional radiologist performing the procedure right here in the Coastal Bend.
It's about a 30-minute procedure. You go into the artery that feeds the uterus into the fibroids and sort of starve the fibroids of blood. They shrink away, and in about 3 to 6 months, most of the fibroids are resolved.
Thousands of women are given the main option to get a hysterectomy, but this procedure helps reduce pain and the lengthy recovery process. The procedure also gives women who want to have children a better chance.
But a lot of the women come in and say that they've never heard of it, they had to find it themselves. So we're just trying to increase education. And my goal is to be partners with the women health providers in the community.
And recovery time is fast. Caroline just had her procedure last week. For more information about the procedure, you can head to christv.com.
You may